Hi, I'm Dee and I would like to share my cancer journey with you. I've called it Finding My Way. This has been a 7-year process and I would like to share what I've been through and what I've done, and we'll go from there. So I was moving towns because I was going through emotional stuff. My kids had moved and so I wanted to be closer to them, and I had a painless lump, and so I thought, oh well, I'm gonna have 2 weeks holiday, I'll get it checked out then. So we moved and I went to a doctor. Never met the doctor before. And I said, oh, I've got a painless lump. Oh, and I also had some unexplained itching. And I was just, that was the main symptoms I was worried about. But when I'd done some research, I'd found out that I'd actually had some other symptoms. I didn't have the classical symptoms. And anyway, the doctor goes, oh, well, we'll take you for an ultrasound. Went to the ultrasound. And she goes, oh, I'm just going to ultrasound the other side. And then went back to the doctor, as you do, to get the results. And he said, oh, you've got some swollen lymph nodes. So it could be infection, it could be anything, but we'll just take you for a CT scan just to make sure. And so then went for a CT scan, and I opened the results, and I know you shouldn't, but my heart sunk. And I remember to this day that, because I've got a nursing background, but I didn't nurse adults, I nursed babies, but I knew enough to think, oh shit, in my heart, even though I didn't have an official diagnosis, I knew I had lymphoma. It was pretty much widespread, so I had it in both groins. These are the swollen nodes that lit up, and I had it in my abdomen, so on my near the bowels, near the lymph nodes, obviously all in there. I had it on the aorta to my heart. I had a spot on my lung and under both armpits. And so when I went to the doctor, he goes, oh, I'm pretty new here too. He says, but I think it's serious. So I don't know if I had a shocked look on my face or whatever, but he says, I'm going to talk to my head doctor and make a referral to you. And that's when he made the referral to the oncologist. So from the scan, things moved pretty fast. I got the appointment with the oncologist, and the first thing he wanted to do was a biopsy, because they need to know what type of cancer you're dealing with, because there is multiple types, which I've learned. I think with non-Hodgkins alone, there was like something like 70 different variants. So they need to know what they're dealing with. They need to know the stage, so how far it's spread in your body, and they also need to know the grade, whether it's slow growing or aggressive. So for me, they originally wanted to do the biopsy in the groin because that's where the largest node was. It was 4.9 centimeters, but I did have multiple nodes ranging from 3.7 to 4 centimeters anyway. And so and they didn't want to do the groin because it's a higher risk of infection and stuff going wrong, complications. So they ended up taking it from my right axilla, and I had to go see a breast surgeon because it's near the breast. And so booked in pretty quickly, got the biopsy done, and waking up out of recovery, he goes to me, he goes, oh, I'm pretty sure you got cancer. He said, because it was quite rubbery, the node. So then that gives you, I guess, time to process as well. The agony was waiting for the results. Even though deep down you know, it's still agony not knowing. if that makes sense. I think that was probably the worst out of everything, was waiting for the results. When the results came, it said I had non-Hodgkins lymphoma, B-cell follicular. So that's pretty much standard type, if you could say. I was at the time stage 3, which means, or even though I had the spot on the lung, stage 4 is when it affects a major organ. And then I was grade 1, which was slow growing. So that was a good thing. Then you get asked, do you have good or bad veins? For me, I had shocking veins, so I got a port in. The idea of a port is to, one, save your veins, but the chemo can deteriorate them. So they can take bloods from there, they can give you your treatment from there. The issue I found with this is not regular pathologies can use it because they don't have the equipment for it. But in there, about an inch, well, I think I had a 3/4 inch needle goes in mine. So once that was in, a couple of days later, so you've got a fresh wound, the scar's up here, fresh wound, it's tender, they want to start treatment fairly fast. So they give you some emula cream to put on before you go for your first treatment, because they know it can be a little bit sore. So I've never used emula cream before, and I was like, how much do I put on? I put on nearly the whole tube. And then when I went in there, to my surprise, on my first day of treatment, my nurse was Tracy, and she was someone I went to uni with. So that was really nice. And she put my first one in, and anyway, she puts it in, and I go, oh, gee, that's amazing. It didn't even hurt. And she goes, how much emula cream did you put on? And I was like, oh, nearly the whole tube. And she's like, you're only supposed to put on a pea size. And I was like, well, take the credit that you've done a wonderful job. And you've got to try and laugh in this situation. You really do. I remember when the port was first in, like now I don't even notice it, but you could feel it wiggle. So this, if you don't know about ports, it goes up into your jugular, comes down, and it just goes into, I think it's the superior vena cava, the top of your heart, and it goes in and it gets flushed out, all the treatment then pretty quick. So I had a chemo buddy, and that was my daughter, and you really need like someone to drive you home after. I remember my first lot of chemo was probably the worst, because you're like anxious, you know you're putting a poison in your system and you just don't know how you're going to react. I did have the gold standard. I had R-CHOP, which is a series of chemos. I won't go into the names, but what they're designed for. So one is designed to kill the node from the outside. One is designed to kill the cancer from the inside out. One's to strangle, and one's to take it away. And for me, to simplify it, that's how I felt I could deal with it, instead of thinking, oh, I've got this really big name, da 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 da. And then I was also having what they call a maintenance therapy, Mabthera, which they were planning on using for 2 years after the main treatment as well. And with that, they gave me Phenergan, and you had that last, and the Phenergan is the one helped to calm, I guess, because it definitely did calm. You could feel it instantly, like I could feel it in my eyes, and I was like, whew, that's why you need someone to drive you home. But I think it was also to help stop any allergic response. And with one of them, within 30 minutes, you could notice like my pee, it changes the colour of your pee. Mine went from a pinky orangey colour. One of my friends who went through cancer, she suggested to drink a lot of water, so I drank a lot of water to try and flush it out as quick as possible. But the first night of treatment was probably the worst, because you're sort of like, oh, what's going on in my body? I had like chest pains, numbness. It was an uneasy night, it was. So just touching back, when I had the biopsy here under my arm, you don't realise how much pain you have after. Like the surgery, the surgery itself wasn't too bad. It was more the fact that they're cutting into your muscle, and you don't realise, you know, how much you bend your arms up to get dressed and do your hair and all that sort of stuff. I think that took me a good month to heal from after. I just wanted to share that. You also go at the beginning, they run a lot of blood, so you get tested for everything under the sun. So AIDS, hepatitis, TB, I think they do some sort of DNA testing and all that. So very quickly, early on, if you're afraid of needles, you actually learn to adjust. You also learn to become your own nurse. So you've got to, it's pretty much like social distancing. You've got to clean hands before everything. You've got to take hand sanitizer with you. You've also got to take your temperature regular, because any sign of infection, you have to go back, because you can't get sick. You've got to try and not get sick. You can't have flowers, because people would want to send you flowers, but you can't, because they can carry bacteria. And the biggie that I mentally struggled with at first was you've got to give yourself some needles. So I had to give myself Neulasta, which helps promote white blood cells, obviously, which helps, you know, build immunity up and helps fight any risk of infection. And I went private, and for them to put it in was $135 a needle. So I quickly learned to inject myself. So one of the advice is to keep a diary. Even if you only write in it occasionally, or when something new happens or whatever, it's good then to reflect. And anyway, the next step for me was to have a bone marrow, just to see if the cancer went into my bone marrow. So in the movies, you show them doing in the hospital, but now they do them in the pathology, and I didn't like that experience at all. It was quite horrendous, I could say. So my daughter came with me, and they gave me a Valium beforehand, because I was extremely anxious about it, because it's obviously, you look what they do in the movies and stuff. And the pathology reassured me, oh, the doctor's very good, even though this is not their usual doctor. And I wanted my daughter in with me to hold my hand, and they wouldn't let her. And this is from the diary, what I've had written. And my daughter was the only one in the waiting room, and they turned the TV up loud so she couldn't hear me. And she said that she moved closer to the door to see if she could hear. While I was in there, they give you an anaesthetic needle, so that's to numb the spot. It numbs skin, but not the bone. And you also got that happy gas to suck on. And that hurt. I found it very unpleasant. I think I remember sucking that hard on the gas that I passed out. My daughter said she remembers them running in and out of the room to get stuff. The whole process took about an hour. I actually said to my oncologist how horrendous it was, and the next two I ended up having in the hospital, where they give you a sedation, and it's much, much nicer. All it feels like is when you wake up is like, you know, someone's punched you in the hip. So if you can, my advice is asked to be sedated. I found that the happy gas, I did not enjoy that. Anyway, the results was I ended up having the non-Hodgkins lymphoma in my bone marrow, so that made me stage 4. So I had it widespread. You also get steroids. So steroids, for memory, I think to help maintain your weight, so prevent weight loss because they don't like you losing weight. And it also, I am pretty sure, helps with new cell growth and all that sort of stuff. So that for me was something I really didn't want. I knew you needed it, but I didn't want because I was terrified of the weight gain. I started off at 89 kilos and I ended up at 104. So for someone as short as me, I ended up being morbidly obese. So just reading and reflecting back in my diary, so one thing, even though you're going through it and you're trying to process and all those sort of things, and the doctor recommends don't Google, but having a nursing background, I just wanted to know everything. I wanted to know what was happening to me, and he's like, I can clearly see I'm not gonna stop you. So if you are going to Google, he says make sure you use proper sites. So like the Cancer Council or medical sites like PubMed and all that. So make sure you have correct information and not just worst case scenario, because you need to be informed correctly. And what I found was if I learned something, I would ask the doctor, I've heard this, da-da-da-da-da. And if you've got any questions about anything, so even if you're not a reader, don't be afraid to ask your doctor. Like I ran into some patients in hospital that didn't even know what cancer they had. They were just trusting the doctor that that was the correct path that they needed to take. For me, because I was just moved, I was supposed to start a new job, and that was a hard thing too. I had to say to work, oh, I'm not starting because I've got cancer. So then I saw cancer as my job. And one thing that I wrote in my diary, because I didn't have the classic symptoms. My bloods were fine, even though I had blood cancer. And I remember saying, here, I read it out, I have cancer, but I don't feel sick. I don't feel like it's going to kill me. I think by taking these meds, the chemo drugs, it's going to take it away. And in my mind, that's what was going to happen, because as I mentioned previously, how they mentioned how the drugs were going to work. Okay, they're going to kill from the outside, the inside, strangle, take away. It was like, that's it. And so then my focus was on that and me. And what you forget is your family's struggling too. I remember looking back in my diary that when I had to go for the biopsy and for the port, there were like 2 procedures before you even get cancer. I remember my husband came and he saw me off, and we were a blended family, and we're only newly together, so we're only married for 2 years and together for 3. And I remember as I was going to theatre, seeing a single tear, go down his eye. And so they're going through stuff too, they're like, oh, am I gonna lose you, And so we had, at that stage, we had 2 teenage girls living with us. We had in total though 5 kids, 2 that came on weekends and 2 that lived with us, and then an older daughter. And I remember when it was newly diagnosed, new treatment, one of my stepdaughters saying to me, oh, you're not going to be one of these cancer patients that are just going to talk about yourself all the time, are you? And that comment hurt me more than anything. I just felt worthless. I felt devalued, and I remember locking myself in the bedroom, not talking to anyone, and I remember going into the ensuite and having a shower and just bawling my eyes out. I think that was the first time, instead of being brave mum, I actually allowed myself to feel it, to mourn it, and it was hard, it was painful. But reflecting back, she was a 15-year-old girl who was at the risk of losing her mum, and she was dealing too. And you sort of got to realise, even though you're dealing, that people around you are dealing as well. And at the time, it's just hard because, you know, we went from a family that had 2 stable incomes to, I had income protection, thank goodness, but to a lesser income. So then we had to survive. The kids had just moved schools. We'd just moved. My job's on hold. My hubby's in a new job. We've had external stresses because we were a full blended family of all of us living, and then 2 wanted to go try live with their dad, and so there was a lot of external stresses going on. And so sometimes when you're dealing with the cancer, it's just not that, and so it's a matter of trying to put you, yourself and your family together in one. And I found for me, even though it did annoy my daughter at the time, I found for me talking about it really helped. And I found knowing, like researching, knowing what it did to the body and all that, that for me is what helped me get through it. I definitely saw it as a job. So the fun part, well, not really, but I thought it'd be sarcastic, the side effects from the chemo. So I had a lot of numbness. So it started with probably with the numbness in the fingers, loss of sense of smell, had numbness on the tip of the tongue, loss of taste, weight gain. I had swelling in the legs, really bad, edema. It was quite painful. I was 40 at the time, and I felt like an 80-year-old woman. I couldn't walk far. The fatigue is huge. It would take me all day to do 1 or 2 house chores. But I would force myself to do something. You get bleeding of the gums, you get ulcers, you get soreness down below, you get constipation, diarrhea. It's not fun. Now, a lot of people, especially when you're a woman, they were really focused on hair loss. Now, I still have, I've got curly hair, and I've never really loved my hair, so I didn't care. And it was just like, okay, I know I'm going to lose my hair, so when do I do it? Like, when do you shave and all that? I got to the stage where I was looking like a mangy dog. Your hair goes all dry and brittle, and it just falls out in clumps, and you could just touch it and it would just pop out, and you'd get handfuls of hair when you washed it, and your drain would be full. So we had, just for fun, we had a shaving ceremony. So I got my daughter to shave my hair, and my husband shaved his just to match off, and he did not want to be bald, but he did it out of support for me. And I found though that people were really pushing the thought that I had to cover up, that I had to wear a wig, I had to wear a cap or a scarf. I was comfortable in my own skin. I was comfortable being bald. I didn't feel non-feminine. I still felt beautiful, but I just felt pressure from the children and just people in general to cover up. I tried it. I went to the Cancer Council because they're all about makeup, feeling beautiful, wearing wigs, and they supply wigs, which is great for people that need it. So I got a wig, and I got a fringe piece and some caps. But I found for me that it itched, and with half an hour to an hour I was taking it off. I was really uncomfortable with it. Didn't enjoy it at all. So I just learnt to love me, you know, and just be proud. Like, it really didn't bother me. So you also go through a range of emotions. It's like, why me? Why has it happened to me? Like, what did I do? Could I have prevented it? I done a lot of research on it, and I realised that I had risk factors in my life, and not gonna blame any, but so I grew up in a family who didn't believe in vaccination, who believed in let you catch it. And I also grew up in a family who did a lot of renovations, so we were exposed to asbestos, a lot of chemicals, and I'm now vaccinated and all those sort of things. And I've also, myself, personally, I ate a lot of red meat, I ate a bucket load of sugar, cleaning chemicals, all those sort of things. So, and spiritually, I had a lot of toxicity in my life. So someone had said to me, were you going through a bad emotional state when you got cancer? And I said, yes. And I was like, how did you know? And she said, sometimes it can be related to someone's emotional state. And when I reflected, I was like, gee, I had a lot of emotional, spiritual, and physical toxicity in my life at that time. And reflecting, I've now made lifestyle changes. And even though you felt alone, I wasn't alone. I did have support, and learning to accept that support is important too. Like, I would have friends on Facebook to say, hey, how you going? Because obviously they can't be there. I would have some people visit. My sister-in-law, she would travel down every couple of months, and she lived 4 hours away, and she'd say, right, you guys are going on a date night and stuff like that. So having supportive family and friends, even if I've even had ones that, you know, wrote me a song and someone said, oh, this song made me think of you. And having that support actually really helped. It was really good motivation. And for me, I used Facebook. I would document my progress, like week 1, RCHOP, you know, next therapy and all that. And I got to see how I changed and all that. Around the 2-week mark, if you're interested, that's when my hair started falling out. So this, I should state the date, was April 2014 when all this started for me. And then the July, on my mum's birthday, I made my first technical remission. So on the scan that showed all cancer, all active cancer was gone, but I had 2 inactive masses in my groin. So that's why they continued the Thera for the next 2 years, just to continue to take it away. So that was pretty good that I made remission. So when I made the first remission, you have, because of blood cancer, there's always a good chance that the blood cancer will come back. If you look at some readings, they say it can be like chronic disease, you know, just part of life. And anyway, you do a stem cell collection, and which means you collect your own, because if it comes back, the best option is to do the beam therapy and get your own cells back so you can have like a restart over. So I collected my cells, and I looked really sick then. I was pale, no hair, no eyebrows, no eyelashes. And you go, and there's only one hospital that does it, and you go and get it done. And anyway, I think that's the time that my family actually thought I was going to die. I actually looked quite sick then. And you've got to inject yourself quite frequently to promote the cells to collect. They want to get like 2.5 million is their aim, and they said, look, you sometimes need a couple of cycles to get that. Because my veins were terrible, they had to put a jugular vein in. They failed doing it in the ICU, and they actually had to put me under an ultrasound me and stuff. So that was a bit traumatic for the family to witness. Oh, like they didn't see it, but just the waiting and the delay and all that. And then they hook you up to a machine, and they take your blood out, and it looks, to me, I would say it looks familiar to, you know, a dialysis machine. They take it out, they get the cells you want, and it goes over a certain amount of time. But that process, I actually felt sick. And the only thing I can explain is that I had like a bubble feeling in my chest, and they're like, can you explain more? And I'm like, all I feel is this bubble, and I was actually unwell with it. So the first collection, I actually got 3 million, which was brilliant. And he's like, oh, since you've done so well, we'll go again. But we ended up only doing half the treatment, and I still ended up getting 2 million. So I've got 5 million in storage for the event that the cancer came back again. Then around 10 months later, because you're adjusting to life, your body's changed, you're physically not the same. So even though you've gone through this, it takes a while to heal. They say 6 to 12 months, but I took a lot longer. I am only just starting to feel good now in my 7th year. I've still got some issues, but yeah, it can take a lot longer, so don't be so hard on yourself. So for me, the 10-month mark, I said to the doctor, I can feel a lump, and he's like, oh, it's probably just scar tissue, you know. And I said, no, I'm really concerned, I can feel a lump. So he did a scan, and the scan showed that the cancer was back in my groin. So they're assuming that that was my primary site. The cancer was nowhere else. So even though they didn't want to do a biopsy in the groin in the first time round, they had to do it this time. And you know, they really mentally prepare you, because it's like near your femoral, it's near your waist system, so you've got risk of infection, and it all went good. Originally I thought I only had 1 node, but then later on I found out I had more than one in that area. And then it was back to having more chemo. But he was worried because of how big it was and how quick the time frame was. He was worried it had turned aggressive, but it hadn't. It was just the same cancer, and then I was on for more treatments. So then he started me off on, I'm just going to read it here, Gemza and carboplatin with my MabThera treatment. He said it's a gentle treatment. My hair had started to regrow back, and he said you shouldn't lose your hair with this, but I did. I lost my hair, and I couldn't finish the full course. I ended up neutropenic, and my liver wasn't coping, and I just wasn't coping. I ended up in isolation for a week, so they had to stop that. And then they retried another regime, which was fludarabine, epirubicin, and still the MabThera. The fludarabine means it does something to the makeup of your blood. So from then I had to, well, now if I need a blood transfusion, I have to have irradiated blood. That didn't work. Same things, ended up really sick again. So we had to stop that. And I said to him, I said, look, I know they don't recommend radiation with non-Hodgkins lymphoma because, you know, it's in your nodal system, can spread, all those sort of things. I said, but since it's only condensed to one spot, can we please try it? Since I've failed so badly with the other ones, can we give it a go? So I ended up having a full round of radiation. I coped with that quite well, but sadly, it didn't work. Like, no. But it was worth a try, in my opinion. It was worth a try. And so then there was 2 drugs in Australia that weren't covered by Medicare. One was $22,000 a bottle. So they were tablet form and not IV form like the others. And they said no. The oncologist said, look, let me approach this other company. They were $10,000 a bottle. And anyway, lo and behold, they said yes. We tried to fundraise in the meantime, but we couldn't get the money. He couldn't get it. And luckily, they said yes. So did a bit of research on it. It was Adalasib. And I ended up only lasting 6 weeks. I woke up covered in bruises. I was neutropenic. I think I went down as low as 0.3. In isolation again. My liver was not coping. He said my readings was of a chronic alcoholic. I felt nauseous, and so we had to stop. And he said generally the symptoms that I had, you know how they do statistics and research, he said generally people don't start showing them until around the 2-year mark, and I showed it in 6 weeks. So I just wasn't coping. Oh, and I must say another side effect from having chemos, I developed tape allergies. Your skin gets really sensitive, so there was minimal stuff that I could put on my skin as well. So then I only had one option left, and that was to do the stem cell, because I had the transplant where I took my own, but that was to get them back. But in my mind, the risk was, well, I've still got active cancer, and they recommend you not doing it until the cancer's gone. And they also give you a really strong chemo called beam therapy, because they pretty much wipe you out and they give you the stem cells to restart again from new. And I generally, if I was well and not going through what I was going through, the technical risk would have only been like 2.5% of something going wrong. But I just had 4 failed treatments of 4 different types. And I said to the doctor, because I haven't tolerated the most gentlest chemo, realistically speaking, I said, not statistically, realistically speaking, what do you think my odds are? And he said probably 75% chance of something going wrong. And at that time I had a 16-year-old daughter, and in my mind I'm thinking, okay, it's only in my groin, it's not on a major organ, I'm not going to do it. I am going to live with the cancer. I actually made peace with myself and the decision that I'll live with it. So I made the decision, as you know, to live with the cancer. I was morbidly obese, 104 kilos. I felt like an old lady. I had numbness. I ended up with calcification in my shoulder. I couldn't lift my shoulder. I could barely walk. I was fatigued. I wasn't in good shape, but I decided to make that decision. I also decided to not go back to work. One, at that time, I wasn't physically capable. My immunity was low. That is still low. That's a side effect I have now. Memory loss is huge. They told me it'll last 6 months to 12 months. I've still got it. Sometimes I feel like I've got Alzheimer's, but you just learn to write everything down, and a diary is really good for that too. I have a diary on my dresser, so every morning I get up, that's what I look at. That's huge. I've tried to relearn stuff. My brain just doesn't want to work. It's only way I can explain, it's fried. Most of the other symptoms, so the numbness has resolved, the edema's resolved. It did take a while. Doesn't happen overnight. I have done things to help my health, which I'll put on more videos. The taste, smell, you know, that's all resolved. The only 2 symptoms I have now is the low immunity. So when people are sick, I just tell them to stay away because I'll end up sick. I have ended up being in hospital with pneumonia and influenza and all those sort of things. So you just learn to social distance away from people. And finally, so January 2016, made the decision to live with the cancer. Made peace with myself. I was going to live with it. And then, you know, you learn to adjust to a new life. Your family learn to adjust. You make plans, but I never thought I was going to die though. Never ever did I have that thought I was going to die. My motto at that time was from Finding Nemo, just keep swimming. And that's what I did. I just kept going every day. Just keep swimming, just keep swimming. And that got me through the whole process. In the April of 2016, I don't even know why I did it. So I made peace to live with it. And then I just found a quiet spot. I was in a good frame of mind. I made this decision to make all these life changes. And I was just like, oh, and the emotional stuff was starting to settle down that we were going through. And I just made this decision. I was like, all right, cancer, you can go now. And that was it. It was just as simple as that. And I just quiet words to myself, and I just said that. And then in May, the following month, I developed some complications that shouldn't happen, and which I later found out it was menopause, so the radiation had caused an early menopause. And so they did a scan, and the scan revealed, ta-da, that all cancer had gone. I reached remission after I'd stopped all treatment. But I still had adjustments to do, but I'll share them in other videos. Thank you for watching, for listening, and if you enjoyed, please subscribe.